For most women, what happens is that you start having more frequent contractions, and the contractions, you're close to term. The contractions get more frequent, they get stronger, they get closer together, and then labor just kicks in and they become regular. They become regular and strong. And most women know when they really get into true labor. At that point, depending upon where your cervix is starting out, if it started out a little dilated or it started out closed, you go through the early stages of labor, which is usually from about 0 to 4 centimeters of dilation. And then after that, you enter what's called the active phase of labor. And that, the contractions are pretty strong. They're usually every 3 to 5 minutes. And the cervix is dilating pretty frequently from about 1.2 to 1.5 centimeters an hour, depending upon whether it's your first baby or you've had a baby before. And then once you get up to about 9 to 10 centimeters, which is complete or full dilation, then you're entering what's called transition, and that's transitioning from when the baby's inside the uterus to when the head starts to really descend into the pelvis and start to come through the birth canal. And during that time, some women have some waves of nausea. They feel an overwhelming sense of pressure. There are a lot of different symptoms that women feel. After you reach full dilation, you start the pushing phase. And it takes certain women, 5 to 10 minutes, certain women 2 hours. And then part of the answer is that it depends upon whether or not you have an epidural in place. Sometimes it takes a little longer if you have an epidural in place. And then after delivery of the baby, you have to wait for delivery of the placenta or the afterbirth. And that usually takes probably 5 to 15 minutes after delivery of the baby. And then the whole process is complete.